So the way protons work is they act like a bullet. They enter in and they stop where you want them to stop. And so the advantage of this is that we can dial up a proton beam that'll stop right in the middle of the tumor. And unlike X-rays, X-rays go in one side and out the other. Anybody who's had an X-ray knows this. They stand in front of the film and a person runs behind them and turns on a machine, and then boom, you get a picture of the bones. And that's because the X-rays pass right through you. And that shows you that everything in front of the tumor and everything behind the tumor, when you're treating a patient with X-rays, is going to be exposed to radiation dose. And all of that radiation exposure does not benefit the patient in any way. The patient is only benefited from that fragment of the radiation that's deposited within the tumor. The other challenge with X-rays is the area of the patient that gets exposed to the most powerful part of the X-ray beam is not right where the tumor is. It's actually just beneath the skin surface. The way X-rays work, fundamental physical property of X-rays, is their most destructive force occurs soon after they penetrate into the patient. And that's usually not where the tumors lie, because the lung tumor is deeply embedded within the patient. Protons, in contrast, their greatest destructive force is just before they stop. So like I mentioned, if you dial up a proton beam to stop in the tumor, that's where the greatest destructive capacity of protons is going to reside. And that's what we want, right? We want the radiation dose to be embedded within the tumor, and that's where we want it to do the greatest amount of damage. And so protons, because of this physical property, can uniquely benefit a patient. For example, with a lung tumor that's sitting right next to the spinal cord, we can aim our beam at that tumor but have it stop short of the spinal cord. With X-rays, we couldn't do that. It would pass right through. And so this is the way that protons can not only help us be perhaps more effective and more smart with how we try to address and treat the tumor, but it can also help us better spare the surrounding tissues.